Well, let's now focus on the United States, where vaccine hesitancy again is a very real problem. And with a resurgent COVID pandemic in the U.S. driven by the Delta variant of the virus, President Joe Biden has said he'd ordered all executive branch employees, federal contractors, and millions of healthcare workers to be vaccinated against coronavirus, and that his administration will issue rules requiring large private employers to mandate shots or testing. Biden also delivered some of his harshest criticism yet of the 25% of U.S. adults who've so far not been inoculated, saying that they're dragging out the pandemic. He said, "My message to unvaccinated Americans is this: what more is there to wait for? What more do you need to see?" He said, "We've been patient, but our patience is running thin, and your refusal has cost all of us, so please do the right thing." So very, very strong words there from the U.S. President. Well, to talk more about the situation in the United States, we're joined by Dr. Peter Chin-Hong, infectious disease specialist from University of California. Thank you so much for joining us on the show again. Doctor, first and foremost, what is the COVID situation in the U.S. now? Have the cases somewhat stabilized?
It's stabilizing, but at a very high level. We haven't come down the mountain yet. It's still at a very, very high level. So that means that we're in a very tenuous situation. There's a lot of circulating virus in many parts of the country. And even though the cases are going down, new cases per day, we're still at the highest levels since January, with a lot of deaths. So in terms of numbers, we're more than 150,000 cases a day and more than 1,500 deaths per day, which is, really staggering if you think about it.
Right. And Doctor, what we now know is that people who are vaccinated also carry the virus. So currently what you're seeing in the U.S., given, the mask mandates were removed, that the Delta variant is moving between the vaccinated and unvaccinated people?
Yes, exactly. It's kind of a perfect storm with a mix of unvaccinated, vaccinated, and a highly transmissible variant. And added to that, there are many parts in the country where additional risk mitigation factors like masking or testing isn't really embraced as much as in other parts of the country. So essentially what you see is two really different countries within one country.
And what is the U.S. doing to tackle vaccine hesitancy? You've had President Biden taking it up very, very strongly.
Yes, so from the beginning of the vaccination program, there was a combination of carrots and sticks. So I think we've tried all the carrots. There have been lotteries and jackpots and, alcohol given if you got a shot. Last week in San Francisco, we can get a pint of ice cream if you show your vaccine card. But these carrots don't work for the vast majority of unvaccinated Americans. I think, therefore, we think about the sticks. So some of the sticks that we've been trying recently include restaurant mandates, but that's not widespread. In some parts of the country, you need to show your vaccination to get into the restaurant or the bar. But I think ultimately what will drive the needle a little bit more will be requirements for work, not just public work, but private sector as well. Requirements for schools. The military now has a vaccine mandate and the Pentagon. So I think this is setting the stage, not just for local jurisdictions saying we think vaccines are needed in the workplace and in schools, but on a national level. And we need a national strategy in this way.
Right, Dr. Peter, now why are so many people in the U.S. convinced about ivermectin as a preventive medicine? It's become a huge controversy there. And having said that, even in India, some states initially gave it out for free, state governments, and even doctors used to recommend it in the early days of the pandemic.
Yes, so in the initial days, it was understandable why people were thinking about ivermectin in the same way they were thinking about hydroxychloroquine or, Kaletra and HIV medicines. In the laboratory, it looks like it works, but the levels of ivermectin, which is an antiparasitic drug that you'd need in the bloodstream, far exceeds the safety profile of the drug, meaning you can get into toxicity if you really try to kill COVID in the bloodstream. And in fact, the studies are not really high quality. They are very mixed, small sample size, more than 15 studies. Some show a benefit, some show no benefit. But regardless, it's become very, very politicized, just like hydroxychloroquine in the US in the early days, so that people are going to animal feed stores to buy ivermectin meant for horses or sheep. And, they're taking these very large doses and they're getting into problems and being admitted to the hospital.
And you're still dealing with the Delta variant, but now there are reports of the Mu variant, which has spread to several states. How concerning is this?
Yes, so the Mu variant is mainly pretty regional right now in Colombia. Initially about not detected then, 40%, now more than 90%, spread to neighboring countries like Ecuador. And in the United States, we have every state reporting at least one Mu variant case, but it's still accounting for less than 0.02% of cases. And the Delta is still the bully in the United States. It's accounting for more than 99% of cases. We don't know much about Mu except that theoretically in the lab, it can have more vaccine resistance like the Beta variant in South Africa. It shares some of the same mutations. It's definitely something to watch. The WHO called it a variant of interest, not concern. And the CDC in the United States hasn't even called it a variant of interest yet.
Now, Dr. Peter, the WHO has asked that everyone hold off on booster shots till next year, considering this divide between, the poorer countries and the richer countries, how unfair it is. And the US is considering booster shots. So what currently is the stand on this?
Yeah, so I think the opinion in the United States is mixed. This is actually the first conflict scientifically in the Biden administration, with the Biden administration really pushing for September 20th rollout of a booster program. But the CDC and FDA and the scientists are really wanting to look more at the data, regardless of how you slice and dice the pie. The vast amount of hospitalizations are occurring in unvaccinated, more than 90%, 95% in some areas. And the deaths are predominantly in the unvaccinated, more than 99% in some cases. So I think there's no real urgency. You can be proactive maybe in the older population over 65, because at the end of the day, personally, I don't care if you show that antibodies wane in the bloodstream. As long as we protect against disease, serious disease, and straining our hospital system, we're going to be okay for the time being.
All right. Thank you so much for joining us on the program, Dr. Peter Chin Hong. They're joining us from the United States.